Hello, Dr. Steven. Welcome to the Gut Field Show. How are you doing?
Fantastic. Thank you for having me.
And I am really excited for this topic that we are covering up today. I would like to, because this is a term which is very new for a lot of people in India, I want you to start with explaining osteopathy a bit. What is it? Just define it a bit, then we'll dive deeper.
Okay. Osteopathy comes from actually an MD, Andrew Taylor Still, during the American Civil War, which was the late 1800s.
Okay.
In that time, Dr. Still lost some children to meningitis, had a brother-in-law that was hooked on what they called laudanum, would be like morphine today. So medicine didn't really offer a lot. He still lost family members to it. And yet he had another, he doesn't say he invented osteopathy, he said he discovered it, meaning that it was always there. And he had a very spiritual outlook on this. You would have to, after having family members die, and then doing something productive. So he studied anatomy and physiology and developed his style of manipulation. First of all, drugs in those days, they were mostly either fake or they were poisons. If you had surgery in the 1800s, probably you'd die from gangrene. So traditional, when we say MD medicine, there wasn't much to offer it. So this is how it started, as manipulation. Not that, again, that they invented manipulation. Manipulation's been around for thousands of years in every culture. But we certainly have our own viewpoint on it and a different philosophy.
Very interesting. And I want you to also elaborate on how to differentiate. Like a lot of people misunderstand it with physiotherapy. Can you give us an explanation how they both are distinctly different?
Sure. Well, you have a lot of different words that are floating around this country now. So other people will be better to speak about the ins and outs of physical therapy, because I'm not a physical therapist. People in India here that are practicing osteopathy, and most of the people that I'm involved with around the world, are physical therapists first, which is a good substrate to begin osteopathy, because they have a good understanding of how the body works, as well as a palpatory experience. The MDs don't really have a palpatory experience. However, the answer to your question, I'm an American osteopathic physician and surgeon, so I'm not like other people that you may meet in Europe and so forth, where they are either going from high school to osteopathic school, or perhaps PT or some other education, and then going to osteopathic school. In America, osteopathy is medicine. I went to 11 years of school. I delivered babies, did surgery, prescribed medicines, as well as manipulation. So myself is a different example than many that you'll run into. So it comes from a very deep understanding of medicine and a philosophy. He still had a different philosophy. 3 important philosophies. He said the body's a unit. 1. Well, when I graduated medical school, everyone was saying, we do holistic medicine. It just became something to say. And you go to Dr. A, Dr. B, they're all doing the same thing. There's nothing actually holistic about it. When we say holistic, I'll give you an example. I'll give you a quasi-medical example. I see people, because my license is general medicine, I would see people that would have these problems, in some cases because they're seeing this doctor, that doctor, and everybody's adding pharmacy to them. No one's really talking about anything. No one's considering how the effects are working on the rest of the body. Now add to that a physical modality. A physical modality, if you are touching people's bodies, very often you'll find other deleterious conditions before the medicine people find it, because we're palpating. A lot of times in medicine, we're not seeing it until it's gotten very, very much more serious. So the body's a unit. That was one philosophy. The other one, second one, was that structure and function have a relationship, meaning that your body is built a certain way. It's probably that way for optimal function, not just randomly that you're built that way. This should underpin the techniques that we're going to create. Third philosophy is that the body has the ability to heal itself. And I tell my students, if you don't believe that, you're in the wrong class listening to the wrong guy. What I don't get involved in is the spiritual aspect of why is something terrible happen to a baby. That's something you can consult whatever your faith is or isn't. That's not a question for me to answer, those things. However, with osteopathy, you have an approach with your hands to general medicine. When I say general medicine, I mean not the medicine pills. I mean, my day is things you would expect for manipulation. back pain, neck pain, headache, and so forth. The other half of my day are just bizarre things where no one else knows what to do. Autistic kids, severe neurologic problems, genetic problems, cancer. I'm not saying I have a cure for cancer, but if you're going to look holistically at the whole patient, it's quality of life.
Yeah.
Maybe you'll extend their lives, maybe not, but you can change the quality of life.
Yeah.
Sometimes medicine, and I'm not saying medicine is bad because I'm trained in medicine the same, but sometimes if they don't have the answer you want, the answer is there is no answer. Now you asked me a bigger question, so I'm just going to prattle on about that. Okay, physical therapy is often very protocol driven, which is fine. You have this condition, here's the things that you should do for that kind of condition. We have that in medicine for everything. You have this condition, here's the surgeries, here's the remedies. Chiropractic has become a very popular thing in this country as well. We also do, I don't want to say we do chiropractic because we were before chiropractors, but to be fair to them, people have been cracking backs and necks for thousands of years, long before chiropractors, long before osteopaths. I want to mention something about that because we have a different philosophy, generally speaking, and that is, I'm not in the habit of treating well people for no reason. And there are other people within my profession, within chiropractic and PT, which it's just business as usual. You come in, do you want the gold plan, the silver plan, the super deluxe plan? How healthy do you want to be? Okay, and I've seen this approach across many professions, not just one, and it really turns me off. There's enough legitimate business, we're in business. There's enough legitimate business for helping people that need help, not addicting people to the idea of coming to you forever or scaring them with, I've heard this exact statement, well, how healthy do you want to be? This
Wow.
is bizarre, okay? So I wouldn't give you digitalis as a vitamin. I'd give you digitalis because you have a heart rhythm. But yet in our field, in manipulation of any title, people are selling it a lot like a vitamin.
So it's unethical medication.
It's a what?
Unethical. It's quite
Yeah, there's a
unethical.
lot of unethical things, okay? We could go into things that might go into politics, which I'm not going to do here.
I know.
Because
But these are things that are actually happening. What you were saying.
yeah, I mean, you look at follow the money, and then
Yeah.
you'll find a lot
on the
of
wrong path.
dark doors.
Tell me more about osteopathy. How does it work? How do you get the information through the hands?
Okay, I'm going to tell you how I get the information to the hands. I'm going to tell you how other people get the information to the hands. I'd say most of the world works in a protocol-driven kind of way. Tell me what happened. Tell me about the accident. How did this happen? Where's your pain? Describe it to me. Then we start taking that like you put it into a computer. Here's what I might do for you. And that is helpful for a lot of people. That is across osteopathy, medicine, chiropractic, a lot of professions, that idea. There's a much older idea of palpating your body and feeling where things feel wrong. We call it key lesion. And what I mean by that is if you came to me and said, Dr. Sanet, my neck hurts, I got in this car accident, blah, blah, blah. Okay, I'm going to find something in your neck to treat. Everybody's going to find something in your neck to treat. Everybody's going to look at the x-ray and read the same thing.
Yeah.
No new information. And maybe that's enough for you. I'm going to look at, I'll read the medical studies, I'll weigh them on a scale, see how much paper there is, and then I'm going to put my hands on you and forget everything that I read and see what feels wrong in your body. And what I mean by that is, my approach, and it's an old osteopathic approach, is I'm going to look for other things that don't feel right in your body, not just what you're complaining of today. A short example, if this shows up on camera, is if I twist my vest like this, maybe you're telling me you got pain up here, you have some pain down here, but I feel this. You don't have any pain there, so you can't tell me about it.
Yeah.
But it feels wrong. So palpation, the two work well together. Palpation is an art. Learning protocols is more a science, if you want to say that.
Can you elaborate palpation?
Sure. Well, I'll give you this example. and I'll drag you into this personally, but you're a young guy. Have you ever had a kidney stone?
No.
You're lucky. I had one, and at 3 o'clock in the morning I woke up, and I won't say on camera how I felt, but I was over at a friend's house, actually sleeping over at a friend's house. I crawled over to his bedroom, and I said, take me to the hospital. He said, why? I said, either I'm having a heart attack in my buttocks, or I have a kidney stone. I believe that's a PG word, we can say it, or you can edit it out. They took me to the hospital, and I get a young doctor, it's a young lady, and I said, look, I'm a doc, I got a kidney stone, let's get the pain control done here. And she's going through everything properly the way she's supposed to do. And she starts to walk around the table. And I turned right around and said, no, don't touch me. Because I know what she's gonna do. She's gonna go and bang on my back to verify that I have a kidney stone. So she'll bang on my back, I will scream, then she'll write down probably kidney stone. This is really a gross idea of palpation. I've caught patients that have had kidney stones, gallstones, somebody with a hemolytic lung was bleeding into his lung. I've caught this by just subtle light palpation. Like, you know what, you're telling me your back hurts. I think there's something wrong with your lungs. You want to go to the ER. Let them check you out. I found that without banging on people and without them barfing up blood being to that point. Now, that's not an easy skill. Okay, you don't fall into that.
I'm sure that's a very.
You don't fall into that, but a lot of things can be felt. If I felt that, I felt, you have this disease going on, I send you to the hospital, and they go, you know what, it's nothing. Patients aren't mad at me. I make an error on the side of safety. But a lot of times I send them to the hospital, there was something going on. And a lot of people that I have trained, people who are PTs that have then learned osteopathic skills, they'll tell me the same stories. I said, you may find the disease before they have to get to the MD. It's not that the MD is dumb, and I'm not suggesting that. It's just you're feeling something from palpation that doesn't feel right to you.
What is that you feel? I'm very curious.
I'll give you an example. Can I give you an example?
Yeah, please.
Okay, here's an example. When I was on my fellowship program, back when I was young and had black hair and was slightly better looking, I was working at a clinic. I'm still a student. It's an undergraduate fellowship, and I'm in a general medicine clinic. It's like a McDonald's. There's 2 doctors, a couple of nurses. We have our own lab, and 150 patients are coming through a day. So, because I do osteopathy, the doctor is in charge of me. Oh, okay, here's your room. Because who comes into general medicine? Diabetes, earaches, coughs, colds, blood pressure, and back pain. Back pain is the #1 reason why people see anybody.
Yeah.
Osteochiro, acupuncture, back pain. Okay? He gives me this guy had a car accident, he was cleared from the hospital. It was a week ago. I treat the guy. It was on I'm pretty sure it was on a Tuesday. I said, I'll follow up with you on Thursday. We'll see how you're doing. This was 30 years ago. I treat this guy, he's all busted up from a car accident, but he's a young guy, strong. I treat him Tuesday, he comes in Thursday. I didn't think he'd be this good. I thought he'd still be kind of busted up and not good. He comes in, he's feeling great. I'm like, oh, okay, I got lucky, or I'm better than I thought I was. Okay, you know what, buddy? I'll check on you next week. This is Thursday. Friday morning, the clinic opens up, he's waiting in there, he's reeling in pain. Reeling in pain. Now, I'm a medical student doing a fellowship program, which means I'm doing another year of manipulation, but I'm not graduated yet. Well, this makes me nervous. I don't know what's wrong with him. So I go to look at him and I palpate him and I go, there's something wrong with your lungs. I don't know what. Okay? So I go to my boss, who owns the hospital where they went. And I said, Kevin, there's something wrong with him. Can we send him to the hospital? No, just go in there, do what you do, get him happy and get him out of here. You know, medicine's a business. And my boss is an uber rich guy. So, and I'm kind of stupid, you know, I'm a student as far as medicine. So I go to one of the other people in the clinic, he's not a physician, but an advanced nurse. I say, Carlo, man, this guy's scaring me. I don't think there's something wrong with him. what kind of thing can we do to test him? He says, hey man, do a VQ scan, man. He's from Cuba, that's the accent. Do a VQ scan, a ventilation perfusion scan. I don't even know what it is. So I go to my boss, I'm like, Kevin, can we do a VQ scan on him? He goes, get the hell out of here. You know how expensive that is? He owns the hospital, so they don't want to spend the money, right? So, get out of here. He says, go in there, turn on the lights, do whatever it is you do that makes people happy. So I go in for the second time. I just don't feel right about it. Whatever I feel, it's creepy. It doesn't feel like what tissues normally feel like. There's a normal feel to things, and then we would use different words to describe spasm, fibrosis, rubbery, or just something that tells me this guy's sick. I go in for the third time. I said, Kevin, can you come in and listen to his lungs? Because I listen to his lungs, I don't hear anything. But, you know, I'm stupid, so maybe I missed something. Carlos listened, he didn't hear anything. I said, Kevin, come in, listen. He comes in. Okay, sir, you're fine. Dr. Sanet's going to help you out. And then he tells me, get this guy out of here. I go in for the third time. You know what? I'm not going to do it. I start to get mad. That's how I work. And since I treat my boss, his wife, and all the other doctors, I have a little bit of clout. I said, you send him. I'm not going to do it. I said, something wrong with him. He's like, okay, calm down, calm down. We'll send him, okay? Sends him to the hospital. I get a call on the weekend from his wife, who is a dermatologist. Hey, did Kevin call you? No. She says, you saved that guy's life. I said, what happened? Well, he had a cracked rib that didn't get picked up on the x-ray. I guess it was very light. He was feeling so good, I told him, just relax, I'll see you next week. What actually happened was, he's feeling so good, he decided to paint his house. And those big five-gallon cans of paint, he cracked the rib that was partly cracked that everyone missed. Me, I could miss it. I'm a medical student. But the hospital missed it. So he cracked the rib, it punctured his lung. So when he's coming in to see me in the morning, blood is leaking into his lung. Now, I didn't hear it. The other advanced nurse didn't hear it. My boss didn't hear it. By the time we got to the hospital, he had a liter of blood in a collapsed lung. He would have woke up dead the next day. Now, I was just a student. So I'm not saying I'm so smart, I just trust what I feel. So if I send him to the hospital and it was nothing, okay, I'm going to make an error on the side of caution. We should make sure we don't make a mistake.
So how do you do that? Is making me more and more curious. Like, is it a different body type that you have that you can read, or you can learn it?
I don't challenge what I feel. When I feel your body, I could teach a child to do this. You and my colleagues here would be more difficult because they know too much. Kids don't challenge anything.
Yeah, kids don't challenge.
I'll drag you into this. Do you have children?
Yes.
Okay.
3.5-year-old.
How old are they?
3.5.
Okay, you're not at the pain stage yet. You're at the stage where you can't get the truth out of them, but you're not at the real pain stage.
Yeah.
I'll give you an example. 7-year-old kid, if you have 3 kids, you come in, the glasses are broken and on the floor. Who broke it? Nobody speaks Hindi, nobody understands what you're saying. They all know who broke it, but nobody knows. You know what? You have one kid and it's broken, well, we all know who did it. Get over here. No. Okay, look, Daddy's happy, see? Daddy's happy. Come over here. You gotta chase him all around the yard.
Yeah.
Oh, why? How does he know? Is it because he's smart? Has nothing to do with that. They don't challenge what they feel.
Yeah.
I don't challenge what I feel. I have plenty of medical knowledge to go through and try and understand what's going on with you. But I don't challenge what I feel. And I spend a lot of time learning how to really feel. If you're a musician and you play music, and I have friends that play different kinds of music, guitar and whatnot, and if I go to a show with them and somebody's playing, I won't hear these little nuances that they hear. Oh, he's not playing well. Oh, I'm like, really? Sounds fine to me, but I don't play guitar. Rachmaninoff was a classical pianist. Rachmaninoff said, if I don't practice for one day, he said, I know the difference. He said, if I don't practice for 2 days, my trainer knows the difference. If I don't practice for 3 days, the whole world knows the difference. So there's different levels of palpation. I don't ignore the information that's given to me, the medical information. I look at it, but there's more to you than just, doc, my neck hurts. There's my neck hurts, but my back hurts sometimes for a couple of years, but I'm not really here for that. I hate my job, my kids are a pain in the neck, my wife doesn't listen to me, and I got some swelling in my feet. This is who you are.
So you listen to the body.
I listen to all of it. And I also listen to your story, and I get more of your story. In other words, what I just said is, you come and say, my neck's bothering me. I'm going to ask about your whole life. Because, again, your neck's bothering you because you had a car accident, it's one thing. Your neck's bothering you, you had a car accident, but your father also died. It's a whole different thing. You can't separate the emotions from the physicality. I don't have the cure for your father died, but that leaves a mark on you. Everything that's happened to you is written everywhere in your body. I'm not a psychic. Your secrets, they remain yours. But I can feel how you feel.
Were you an empathetic kid growing up? I want to understand your personality now because it's quite intriguing to me, because you are a good listener. That means you're a great listener because you're listening to a lot of things.
I'm a listener, and I am empathetic about a lot of things. I'll tell you from my growing up. I don't know why. I've always been kind of really sympathetic for Down syndrome kids. Down syndrome. When I was young, we make fun of them. We say things. I said bad things because other kids were doing it. Inside, I felt sick saying it. I feel really bad. I want to do something for them. Okay. Before medicine, I did martial arts for 20 years.
Wow.
Yeah, 20 years. I had a class, I would teach kids from 5 and up. I had a class, I had a little boy, 6 years old, Christopher, and he was able to do things. Kids are fun to teach. Christopher was able to do everything, and his brother, who was 8 years old, Danny, would come to class and watch in the chair, okay? This is my karate days. He would watch in the chair and he'd mimic the motions. And like a lot of Down's kids, they're always smiling and kind of laughing, in addition to being hyperactive. So Chris is a student, I'm teaching him, he's learning, his brother's trying to mimic him. And I said to the parents, I said, you know what, I think I can teach Danny. You don't have to pay me for Danny. Just bring him into the class, I want to teach him. In 3 months, it took him longer to learn than the other kids. I can't do it on camera. In 3 months, he was able to lift one leg up in the air, jump and kick with the other leg and land on one foot, and able to do a lot of coordinated things. The parents came to me and said the change is so dramatic in Danny because in the United States, they're mainstreaming these kids. So they would he's high functioning, they would put these kids in classes with kids who are doing stimming and not speaking, like very severely handicapped kids, all in the same class. So he would come back mimicking worse behavior. They said he would never ride a bike. He rode a bike in 3 months. He could never balance on one leg. I just told you, he could jump and kick with one leg. And he could never do a pogo stick. Where do they even get that idea? You know what a pogo stick is? Who even thinks of that? Anyway, he's able to do all those things. And then the parent said to me, you know, maybe you could introduce this to the school. You've had such good success with Danny. I said, I would do that for nothing, just to be the guy to do it. They wouldn't even let me speak to them. Why? Because I'm a karate guy. I'm a nothing. I'm a hamburger flipper in their mind. And you think they're going to let me show PhDs how to make them look foolish, which was not what I'm interested in. I just want to see if I can make the difference. But I definitely had a soft spot for kids like that, and kids in general. There's a lot of things you can do. I've got autistic kids to speak that never spoke.
Wow.
I don't want your listeners to think that Dr. Sanet touches everybody and everyone's healed and everything's well. No, sometimes there's small miracles, sometimes big ones, sometimes nothing. But what does medicine have to offer those kids? Nothing.
Yeah.
It's not that they're bad, but If you go to a surgeon and say, well, what do you think about my case? Well, a surgeon does surgery. So they look, are you a candidate for what I know how to do? No, I'm sorry, there's no help for you. So medicine is good when you need it. When you don't need it, it's not a vitamin. And I look at manipulation the same way. Going back to what we said earlier about people that are predatory. You need to come in 3 times a week. You're on the 3 times a week program. No, you're making people dependent on you. Not just physically, but you're making them emotionally dependent on you. That is so wrong in so many ways.
My next questions are on those lines only. So we'll take a minute break. These guys have to reset the camera. We'll resume.